Next topic is risk factors for emergence or re-emergence of zoonotic diseases, also known as determinant for emergence or re-emergence of zoonotic diseases. As we know, zoonotic diseases are the diseases, and every disease has a epidemiological triad which has three components. One is host, one is agent, one is environment. So we have three kinds of factors or risk factors related with the emergence of the zoonotic disease. First is host factor, second is agent factor, third is environment factor. So agent factor means the causative agents. So these causative agents itself undergoing a change. So these causative agents, they undergo a change. We'll discuss later what are the changes. Second is host factor. Change in immunological status of individual or population. Change in immunological status of individual and population. Number 3 is environment factors. Environment factors mostly include ecological change. Ecological change or climate change. So this ecological change is the most important factor in the emergence of the diseases. So we have three factors: agent, host, environment. Out of these three, the most important factor for the emergence is the ecological change, which comes under the heading environmental factors. So first we'll see what are the agent factors responsible for the emergence of zoonotic diseases. Agent factor. From this triad, first is the agent factor. Agent means these are the pathogens, these are the microbes. These microbes, they undergo adaptation and change. And these adaptation and change, these are at the molecular level. For example, these microbes may be viruses, these may be bacteria. So mostly virus and bacteria. In case of viruses, what kind of molecular changes happen? First is genetic drift. The example is avian influenza H5N1. Because of this genetic drift, new strains, new variant comes that may lead to pandemic. Then genetic recombination. Western equine encephalitis. That was a recombination of two viruses. Eastern equine encephalitis and Synbis-like virus. From the genetic recombination of these two, what evolved was the Western. Then COVID-19. COVID-19, various strains, alpha, beta, delta, all these because of genetic recombination. And the phenomena that involved in recombination is the template switching phenomena. That is, RNA which act as a template from two strains, they recombined, and the phenomena is template switching phenomena that led to new variants of COVID-19. That is genetic recombination. One is triple reassortment. That happened in case of H1N1, that is swine flu pandemic of 2009. So these are some of the mechanisms, some of the adaptations or molecular changes that may lead to new variations, new variant of a particular virus, and that end up with the pandemic. So genetic drift, genetic recombination, and triple reassortment. Next is bacteria. Bacteria, their mechanisms are conjugation, transformation or transduction, and acquisition of multi-drug resistance. The example is MDR tuberculosis in case of human being. Next factor is environment factor, and within this environment factor the most important is the ecological change. This ecological change is caused by human activities. So these are the human activities, and these are the related emergence of zoonosis diseases. So these are the human activities and these are the resultant emerging zoonoses. So number one is the agriculture and change in agricultural practices. So in agriculture practices, number one, increase farming activity and inadequate rodent control. So because of the increase in farming activity and inadequate rodent control, there is increased in leptospirosis in these three districts, Tamil Nadu, Kerala and Andaman, in the past 2 decades. So because of the increased farming activity. Number two is water irrigation. Number one is rice field irrigation. So with rice field irrigation, there is a high risk of emergence of leptospirosis and Japanese encephalitis. And with this irrigation or stagnant of water, there are risk or chances of increase of mosquito-borne diseases, and because of the stagnant water, snail infestation, as well as there is a risk of schistosomiasis, that is the human schistosomiasis, cercarial dermatitis. So irrigations and farming activities, these are the agricultural practices which lead to emergence of the leptospirosis incidents and schistosomiasis, JE and lepto. So ecological change which is caused by these agricultural practices will modify the natural equilibrium, will modify the natural econike that lead to, or that modification, it occurs at the origin of outbreak of previously unknown diseases with high case fatality rate. So because of these agriculture practices, the natural econike or the habitat or the natural equilibrium get disturbed, and because of that there is chances of outbreak of the previously unknown diseases, and that is with high case fatality rate. So after this agriculture practices, next we'll see what are the human activity which are related with changes in livestock farming practices. So these were agriculture practices, farming activities, water irrigations. Next is your changes in livestock practices. Changes in livestock farming practices, that is farming of new animal species, lead to new outbreaks. For example, ostrich, that is a game farming animal. So farming of this new species ostrich led to outbreaks of Congo Crimean hemorrhagic fever, CCHF, in South Africa. Cases were detected when they slaughtered the animal in slaughterhouse, this ostrich. Number two is deer farming. Deer farming, outbreaks of bovine tuberculosis. So whenever there is a farming of new animal species, that end up with the emergence of new outbreak. Next is air pollution. SARS 2002 outbreaks. Those people who were living in polluted cities, they died because of the this infection, because this air pollution created a lot of respiratory difficulties in the highly polluted areas which were affected by this virus. Next is bioterrorism. Bioterrorism is a kind of a war situation which led to the emergence of the disease anthrax, that is a zoonotic disease. So these are 3/4 human activities, and these are the emergence of the zoonotic diseases directly linked with the human activities. Next is the breakdown in public health measures that led to re-emergence of human plague in 94 in two epidemics, one in Maharashtra, that is Bid district, and one is Gujarat, that is Surat. So that was a re-emergence associated with the human activity, was breakdown in public health measures. Then construction of dams. These are the emerging zoonotic diseases: RVF, schistosomiasis, cutaneous leishmania. Then cultural anthropological norms. In case of Kenya, these people allow the dogs and hyena to eat human bodies which are infected with hydatidosis. That led to emergence of this disease. Deforestation. Because of deforestation, there was emergence of Kaisnor forest disease in Shimoga district of Karnataka. Reforestation, Lyme disease in USA. Because of reforestation, number of deers increases and deer tick also increases. So these deers, they come in contact with the human, and these ticks were the natural reservoir of the disease. So because of human animal interaction, there was emergence of the Lyme disease as a result of human activity, reforestation. These are two natural disasters, earthquake and flood, that also led to emergence of the zoonoses. First is earthquake. There is one example on 26 Jan 94 in Surat. There was an epidemic of pneumonic plague. Because of this earthquake, those rats' habitat were destroyed. They comes out and come in contact with the human. So that led to epidemic of the pneumonic plague in district Surat of Gujarat. Then second is the flood. In case of flood, leptospirosis emergence are there because of the contaminated urine of rat and domestic animals that comes in contact with the human being. So these are the two with the natural disaster. Next is the industrialization, industry. So because of the industrialization, continuous industrialization of food processing, there is emergence of foodborne pathogens. These are the four examples: E. coli O157H7, Salmonella typhimurium DT104, Listeria monocytogenes, Salmonella enteritidis, and Campylobacteria. These are the foodborne pathogen because of the industrialization of food processing, emerging diseases. Next is urbanization, that is the movement of the human being. So the workers from the rural area, they move to the cities, they work here, and permanent movement of this human being from rural to urban cities, that is urbanization, lead to outbreak of these three diseases: brucellosis, vampire bat rabies, and Lassa fever. Next is globalization, means international travel, international trades. So international travel is nothing but the movement of the human from one country to other, and that may lead to travelers diarrhea because of E. coli, amoebiasis, giardiasis, and salmonella and shigella. So these are related with the traveling. Then international trade of animals, that is the anthrax, brucella, CCHF, emergence of these disease. But if the trade is related with the food stuff, then enteric zoonotic infections, salmonella mostly, and campylobacter. Then next is the technology. Because of changes in some technology, some process, there is emergence of the zoonosis. For example, changes in rendering process that led to bovine spongiform encephalitis BSE in cattle, and changes in food processing technology. Because of that, contamination of E. coli O157H7 that led to hemolytic uremic syndrome in case of human being. The last human activity which is related with the emergence of the disease is the human demographic and behavioral change. Here HIV is the example. So human demographic and behavior change, which include lifestyle changes, and human demographic means inhabiting a new area. So these are the 13 human activities which is related with the emergence of the zoonotic diseases. So our next factor is host factor, which is nothing but the all these 13 activities also comes under host factor. So next is the host factor. So these human activities comes under the host factor. There are 8 principles of control of zoonosis. These 8 principles, they are in sequence and you can easily remember with this mnemonic: Dr. Vet is rich. Dr. Vet is rich. So D means detection, that is detection of the zoonosis. This detection is through surveillance. Surveillance in case of human and animals population. So with the human or animal population, there are some national level surveillance systems, and with human, that is IDSP under Ministry of Health and Family Welfare, and related with the animals, these are your NADRS, NADRES, both are under Department of Animal Husbandry and Dairying, Cadred IVRI, Nishad Bhopal, Nivedi Bangalore. So these are detection of the zoonosis through the surveillance system, which are one for animal, one for human. Once the zoonotic disease are detected, then reservoir neutralization. So R is the reservoir neutralization by test and removal or elimination. Next is vector, V for vector control or vector elimination. So we can control the vector by the use of pesticide or PISC, that is plant insecticidal spray campaign. After ET for environment manipulation, that is environment manipulation is to control vectors and rodents. R is reducing contact potential. Reducing contact potential, that is by isolation of the sick animals and with the help of some biosecurity measures. After R, I means increasing the host resistant, that is by immunization or vaccination. C for consumer protection, that is of greater importance with respect to foodborne zoonotic diseases. So this consumer protection is by following the HACCP and ISO 9000 procedures. After C, there is H, that is health education of the general public. So this health education is provided by the veterinarians, doctors, public health workers and some NGOs. So these are your 8 principles, and the mnemonic is Dr. Vet is rich. That is D for detection, reservoir neutralization, vector control, environment manipulation. R is reducing the contact potential. I means increasing host resistance, or C for consumer protection, and H for health education. So you can easily remember these 8 principles of control of zoonosis with the mnemonic. In the next lecture, we'll discuss the impact of zoonotic diseases on human health, animal health, and on the society.